Do you wonder if you're the best version of yourself? This is the question we seek to answer in this podcast. We reveal information that helps you recover your health and become resilient. Modern life makes us fragile. Our diet, lifestyle, and environment set us up for failure. We do not accept this. We seek optimization. We strive to become dynamic. Hey, what's going on? Dr. Chris here today. Today I want to talk about a really specific and technical idea, which is called the Metaboreflex. I recently did a podcast with Luke Way, who is the owner of Autonomic. It was one of my favorite podcasts I've ever done. It's so interesting. So many cool and actionable things you can do, and what a cool product. So if you haven't listened to that, go back and listen to that podcast. But one of the things we talked about was the Metaboreflex and how fatigue in muscles may not actually be due to the muscles, but maybe due to this reflex. I was already very excited to use the Autonomic product for a whole bunch of reasons, mostly from some of my own lung breathing issues and potentially solving sleep apnea. But when we talked about this topic, it was kind of an aha moment for me and was just so fascinating. I just felt like I needed to do a bit of a deep dive on it. And in case you didn't listen to that podcast, you're wondering what I'm talking about, the Autonomic is a device. It's a rebreather bag, and it can train it trains a bunch of things, but it's meant to optimize sports performance. It kind of plays with your gas exchange and improves your output of your lungs. And it just so happens that this has all kinds of rehab implications as well. But anyways, let's get into the Metaboreflex and what that is. So the Metaboreflex is a cardiovascular reflex, and it plays a very crucial role in regulating blood flow and maintaining homeostasis or balance during physical activity. When your autonomic nervous system senses changes like metabolic waste products or byproducts in the bloodstream, this reflex kicks on. So some of these waste products, I want to be clear about this, it's not lactic acid. Everyone thinks that burn you feel is lactic acid. Your body takes glucose and breaks it down into lactate, which is your fuel source, and hydrogen ions. So the hydrogen ions is what typically causes the burn you feel in the muscles, besides when the Metaboreflex is kicking in. So the key role really of the Metaboreflex is to increase the heart rate, blood pressure, and respiratory rate in response to basically metabolic demand. And then it sends blood to the active muscles. So at rest, or if you've just had a meal, your blood your blood's always pooling in certain areas, right? So if you're just resting or eating a meal, you're going to have a higher percentage of your blood in your gut to help digest. If you're in a classroom or studying or reading a book, you're going to tend to have more blood in your brain. And then when you exercise, it's going to move out to the periphery. And the Metaboreflex is the part of this system that moves the blood to the areas that you're using. That's where you get that muscle pump. That's blood. So when you begin to exercise and you use up the oxygen and some of the other things that you need to move your body, there's afferent nerves, the group 3 and 4 afferent nerves, sends signal to the brain and tells the brain that the muscles need more oxygen and nutrients. So in response, the brain will then start the sympathetic nervous system. It will kind of fire that up, and that triggers heart rate, cardiac output, and vasoconstriction for the areas that are non-essential. I think of this as a bit opposite to a cold plunge. So if you've ever done a cold plunge, you may notice your hands and feet get cold. Well, it's the opposite response to this. So your body's saying, we're under threat, we're really cold, we need to make a choice to make the organism survive, and it pushes all the blood to the vital organs. So the Metaboreflex, under normal circumstances, does the opposite. It says, okay, we're using the legs, the arms, maybe you're biking or you're on an assault bike or elliptical, something like that, and it says, okay, priority is now the limbs. So it shunts the core and pushes it towards the periphery. And so like many, or probably all systems of the body, it's adaptable. So it's something you can train. So for athletes, or especially those that are doing endurance sports, training can actually help you fine-tune this reflex, allowing for better blood flow while under duress. And this will usually translate to improved exercise tolerance, better recovery, and just better overall output. And there's also kind of a correlation between the metabol reflex and orthostatic hypotension. So orthostatic hypotension is when you stand up quickly, particularly if you're coming from like a seated or laying down position, your barrel reflex doesn't respond adequately and you feel faint or lightheaded. You can even pass out. So both the metabol reflex and the barrel reflex, which is the one that kind of controls that orthostatic hypotension, are controlled by the autonomic nervous system. So if there's any dysregulation of the autonomic system, you can experience these symptoms. You'll often see orthostatic hypotension in some of the older folks with chronic conditions such as diabetes or any kind of neurodegenerative disease, chronic hypertension. These things can all impair the autonomic nervous system in general. Along with these chronic conditions, you tend to get more of a sedentary lifestyle and basically decreased exercise tolerance. So what I'm suggesting here is that people with these types of conditions might experience a blunted response by the autonomic nervous system and have a weak metabol reflex and may be prone to drops in blood pressure when standing. So it just might be the case that working the metabol reflex and fine-tuning that may improve orthostatic hypotension. So, that's all interesting stuff. But the thing that really kind of caught my attention that I thought was fascinating is that when you really push your body and your lungs start, I don't want to say failing, but they're under a lot of stress, then your body is now forced, your nervous system is forced with a decision. Do you keep shunting blood and oxygen to the muscles that need it, or do you send it to the heart and lungs that need it? And the nervous system is designed to protect you and keep you alive, first and foremost. So it'll then, at that point, start to shunt the blood more toward the lungs. So then you become ischemic in whatever muscles you're trying to use, and you get a higher buildup of hydrogen ions, and then you get that burning sensation. In other words, if your cardiovascular system is not adequate to meet the demands of whatever exercises you're doing, it just may be the case that burn you feel in your muscles is from a deficiency in your lung output and not from the actual burning of the muscles themselves. Now, if you're just a cardio machine, you do tons of cardio work, tons of zone 2 training, and you're good there, it just might be the burning of hydrogen ions in your muscles that you feel. But if you're not doing a ton of cardio and you get that burn, maybe you need to work on some cardio because the lungs are now becoming the rate limiter. And I've seen this. Now, this is anecdotal, but I used to work with a lot of COPD patients. And, we do a lot of cardiovascular training with them to try and improve their output, their cardiac and their lung output. And so what you do is you put a pulse oximeter on their finger, you watch their oxygen saturation, maybe it starts off at 95% or something like that. Ideal is 98 or more. But because they have a breathing dysfunction, they're getting less perfusion of oxygen to the periphery. That's why the finger's got a low oxygen. And then you start them off on something gentle like a bike, going at a moderate pace, and you'll pretty quickly see an uptick in their oxygen saturation. So they'll go up to 98. Depending on their physical fitness, they'll go up pretty quickly. That's the metabol reflex sending blood to the periphery. But what I would always notice is once you start to push them and they're really huffing and puffing, the reverse happens. Then the oxygen saturation starts to drop. And I think this is evidence of exactly what we're talking about in this podcast, that metabol reflex making the decision, hey, do I want to keep this person doing this exercise or keep them alive? And it's saying, okay, let's keep them alive. So now the blood and oxygen are shunting back towards the lungs, and you get a drop in oxygen saturation. And this is why, from a rehab perspective, I'm so excited about this product, because we'd have to stop those patients at that point. Now, what if there's a way to train their lungs to a point that they can match the performance of what their muscles are doing? You can get results way faster. Now, again, this is speculative. Someone needs to do a study on this. I think this is really cool stuff. Regardless, check out the Isocapnic podcast I did with Luke Way. I will also drop a link to the product in the show notes. A ship in harbor is safe, but that's not what ships are meant to do. What does this mean? It means exposing yourself to difficult situations so you become resilient. If you need help building resilience, check out our flagship program called Physiologic Flexibility. This is a 3-month do-it-yourself program that teaches you how to maximize your homeostatic regulators, such as your pH, blood glucose, O2 and CO2 tolerance, and temperature. We give you specific action items through the program with the goal of becoming anti-fragile. If you want to become the inspiration for your friends and family, this is the program for you.